of the myths you would have surely heard is that we have the best healthcare system in the world. And it starts out a long list of lies, but it only is the best if you are healthy and or wealthy. We already have the rationing that everybody's talked about by ability to pay. The free market is a suitable setting for the provision of medical care, and profit is the best organizing principle. Myth number 3, we can say. The problem is that profit motivates corporations, which are the movers and shakers in our healthcare system, to develop more saleable products, from pharmaceuticals to technology to equipment to insurance to hospital beds, and the list goes on and on, rather than to consider what the real needs here are for improvement for the public health. No measure that does not produce a profit receives any attention whatsoever. The emphasis is totally on making a buck. Then there's the next myth. There actually is a free market in medicine. The fact is that there are typically very few choices in most locations, especially in rural areas. That is true for all providers, from suppliers to insurance companies. And additionally, the insurance companies and providers do not sink or swim on their own efforts. The government is a very big subsidizer of medical costs. The question is, what do they subsidize? The United States government already pays more for medical care. Just the United States government, more for Medicare, much of it through private insurance, than total spending in any other developed nation. Another myth. Patients are wise consumers with the free market model. You know what they say. Let the patients choose. Do it according to the costs of the medical care. Now, I don't know what you have thought if you've ever looked at one of these policies. I wouldn't say that I could figure it out, and I'm supposed to know something about medicine. They are very complex. You have to compare the different offerings and their prices between insurance policies, and you have to know what they're going to come up with in the future. All of the things you've heard about rescission has to do with revising past decisions that were made. And we've seen this with Medicare Part D, for instance, where patients choose a particular company for a particular product that they're selling, and then the company can change what it offers, even if the patient can't change the company. And in an acute situation, very few people have adequate information to make good choices quickly and are under too much stress to choose wisely. And the poor and the chronically ill and the aged are the most disadvantaged. Now, some people think that the free market is good for doctors. Not so. Both individual and group providers carry much uncompensated care on their books, and their administrative overhead is huge for pre-approving, resubmitting, appealing, billing, and collecting. This is in addition to high private insurance overhead. Additionally, U.S. doctors face more intrusive cost reviews. Every doctor has multiple administrators in his or her office to deal with all of these issues. And most doctors, by the way, in spite of what the AMA says, which is not joined by most doctors want a single-payer health care plan.
We do have a historic chance this year to make improvements in our healthcare system. How far it will go, nobody knows. The House of Representatives already has 3 pieces of legislation in committee that they're ready to vote on when they go back. The Senate's not as far along. The Senate is really where, if you're going to make any calls into your U.S. congressional representatives, Senator Byrd, and especially Senator Rockefeller, need to hear from you. We need something with a strong public plan to come out of the Senate Finance Committee. We need something strong to come out of the Senate. And we need it to be quick. We need by the middle of the month. When they go back next week, They'll be off their summer recess. They really need to put the axe to the grindstone and to get a piece of legislation out so that we can get this in conference committee and get a strong public option passed. I don't know how much you all have been following the debate on healthcare reform, but as Hedda said, the public option is, I think, a first step, hopefully a big step in the right direction. But to get there, we need to all be active. We need to raise our voices, to lift up our voices. So take home petitions, call your senators, and call, well, for here we're stuck with Shelley Capito, who doesn't think we need major reforms in our healthcare system. She thinks that tinkering around the edges would do the job. So I think we all need to send Shelley Capito a Band-Aid and say, no more Band-Aids. Let's fix it right this time. And I think I'm gonna, and the other thing you can do is tell your story. Tell your story to whoever will listen. Tell it to your senators. Write it up in a letter to the editor. Call in on those radio talk shows. Call in and talk to Hoppy and tell him your story, because he needs to be convinced that healthcare reform is really something that we need right now. It's not just a market commodity. Well, what's happening both here in West Virginia and at the national level is a lot of groups that normally don't play well together are working together. The single-payer groups and the not specifically single-payer groups, the MoveOn.orgs and the Acorns, and even the YWCA is involved in Healthcare for America now. And labor and social workers, there's always a big labor presence in any healthcare action these days. And we've been doing that here in West Virginia too, because we've been working closely with the State Federation, the AFL-CIO, the communication workers, SEIU, groups, the union that takes care of the nursing home people and things like that. So there's a lot of unity around this issue.
Gary Zuckett, West Virginia Citizen Action, Executive Director. And we're here today for a community discussion about healthcare reform. I think most of the people here really feel that the country is long overdue for a reform of the healthcare system where we can get insurance coverage for everyone here in this country. Studies have shown that 4 people a week here in West Virginia actually die because of the complications of not having health care, not having health insurance. They don't get the proper treatment on time, and in that regard, treatment's more expensive, takes longer, and sometimes is unsuccessful. So we have a lot of actual casualties here in West Virginia. There's a lot of stuff flying out there about healthcare reform and what it is and what it isn't. And these type of community discussions, I think, helps clear the air and calm people down so that we can talk about the facts, we can talk about the issues, and not about the wild allegations that are going on out there.
Yes, sir. Anything you'd like to add in conclusion? That was great.
So, well, I think we're in agreement that we really need a new public insurance option in this country, something that will give people an option from the for-profit insurance industry, which has been shown to be so abusive to people that actually get sick and need their coverage. So we really think we need an option, a new option for the people that have been failed by the insurance industry.